The views and opinions on this program do not necessarily express the views and opinions of the management of 58 WCHS or West Virginia Radio Corporation.
Hey, good Friday morning. Yes, it's Friday. As they say, thank God it's Friday. And this is Ask the Expert on WCHS. Today, Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center, is going to be with us for the next hour. And Dr. Jeannie K., good morning.
Good morning to you, and how are you today?
I'm good. I just, of course, like so many, watching this coverage of the events in Boston and area, so so much of the nation's eyes trained on that. But, happy about Friday, happy that spring's coming. But as, let's say, a walk into this talk we're going to have today, boy, this particular season, certainly with sleep disorders, boy, I bet all this great pollen and allergens that are just flying around certainly have an effect on those sufferers.
Oh, it has a major effect on people trying to get good quality sleep, because when you can't breathe, you don't sleep well.
Well, again, when you talk sleep and TMJ Treatment Center, well, sleep disorders. And I think many of us go through different stages of that. But during this season, and I'm lucky, blessed not to have those severe reactions, but I can't imagine somebody that is fighting for their sleep anyway, trying to get real rest, and they're, sleep apnea or whatever other issue, and now here's all the allergens and the pollens and the molds, and it has to be a time when that suffering really seems to magnify.
Well, Mike, when I do treat patients, I always go over how to keep your sinuses clear. There's some really inexpensive, like little neti pots and sinus rinse you can pick up at CVS and all of your local Walmart, Kmart, whatever. And it's very inexpensive. And on my sleep patients at this time of year, I always recommend that they flush their sinuses out so that it will decrease the swelling and get out all of the pollen that's there.
304-345-5858, 304-345-5858. If you'd like to call and ask Dr. Jeannie K. Bailey a question, and maybe you're one of those, or you're seeing some increases, or things do change in your body as you age. Sometimes what was not so bad 10 years ago has become rather acute in your reaction to spring, and you'd like to get some answers. This is the day to do it. You talk about this wash or flush. What's the name of that product again?
I like Neil Med. It's the pharmaceutical company. It's called Sinus Rinse.
Okay.
And that's a simple thing to remember. And it is so inexpensive, and it's a saline. It doesn't hurt. Now, it's not the prettiest thing in the world when you flush your sinuses out. But, we actually need to breathe through our nose to stay healthy. It warms the air that goes into your body. It filters any virus, bacteria, and it serves a lot of wonderful things as far as oxygenation. You get better oxygen when you breathe through your nose instead of through your mouth. So it does a lot of wonderful things. So nose breathing is hugely important to stay healthy.
I'm here with Dr. Jeannie K. Bailey. It is Ask the Expert on WCHS. 304-345-5858 if you'd like to call in and get your questions answered today. It's really some good advice, because I don't think most people would even be aware of that kind of product. And in fact, we had a little conversation off there, but my cousin Terry really got hooked to the little sprays, the open your, passageway spray for years. And it took him a while to get off of it, but it almost was an addiction. Now, he had some issues of breathing and spraying, but instead of using a flush like you're talking about, he got hooked on that spray. And I think a lot of people inadvertently start using that spray and then get so dependent very quick.
Well, I used to raise horses when I was a child, and I had to put hay out twice a day. So I had a huge allergy to hay. So I had to make a decision. Either you give up the horses or you take the allergy with the hay. And I, too, got hooked on that nasal spray. So I had to wean myself off and stop.
Well, it's tough. You want to breathe. It's kind of a natural thing to want to do. And then to be allergic to hay and then to be around horses, boy, talk about being thrust into the fire pit there.
But those were the best years. Wonderful. Love raising horses.
Well, there's this may be a little off topic, but and I say this very affectionately. I've had an opportunity. One of my good friends back in Chicago was a horse guy, horse people. And their own community, and they buy and trade, and so much of their life revolves around their ownership of horses, being around different activities, seeing kids learn to ride, getting their first lessons, but there's a real bonding there with people who love horses. I mean, different than just dogs and cats. I don't know how to explain it because I wasn't one, but I certainly was an observer, and these people just love horses and love all the things about the horses and the barns and riding and again, seeing those kids learn to ride at their first times. And, it's a real community. And
then we have, at the end of this month, our 4-H projects coming. We have cows. I have a daughter and a son who are in 4-H, and they will have a feeder calf and a replacement heifer, and that's coming at the end of the month. And my children are very involved. They have to go out twice a day and feed and clean and brush, so it's a 4-H project. We're looking forward to our babies coming.
Oh, that's great. I'm here with Dr. Jeannie K. Bailey, Sleep and TMG Treatment Center. The number here is 304-345-5858. And another thing noteworthy, you were telling me about that right now, those same children you talked about, they're at Envirothon somewhere in Wood County?
Yes, at the 4-H camp in Wood County, they have a project called Envirothon. And the 4-H children have to compete at a state level, and it's on how to keep the environment healthy.
Oh, well, very good. And when and just to get out there and be with some kids. Now, is this kind of an all-day thing? Is it overnight? How does that work?
They competed all day yesterday, and they compete all day today.
So it is an overnight thing. Well, that's fun, though, to get out and be involved in. 4-H is, through the years, such a solid, wonderful environment for kids to be involved in. And the projects, and what I love about the projects there, it's the real thing. I mean, you're really involved, whether it's with livestock or other efforts. You've got to involve, and it's a commitment. It's not something you do on a weekend or once a week. You're committed to that project. Yes,
and 4-H stands for head, heart, health, and what's the other H? Oh my gosh, I've been a 4-H person all my life. Head, heart, health,
hand.
Yes, it is, because you help. You're good. Thanks. Okay. I blanked there for a second.
I came from Chicago. There wasn't too many 4-H things around there. Anyway, this is Mike Agnello on Ask the Expert. We're here with Dr. Jeannie K. Bailey, Sleep and TMG Treatment Center, 304-345-5858. If you'd like to call in, and we'll take a short break and be back. This is WCHS, the voice of Charleston.
100% powered by American exceptionalism. The voice of Charleston. Voice of Charleston is 58 WCHS.
Our customers have asked for it, so we're continuing our celebration of American quality at Pew Furniture Warehouse showrooms. How are we celebrating? By taking an additional 10% off all furniture made in the USA. That's 10% off already discounted prices on handcrafted sofas, sectional sofas, leather sofas, and sleeper sofas. 10% more off all recliners except for our Southern Motion recliners that are buy one, get one free. Now that's hard to beat.
More truckloads have just come in, so our selection is better than ever. 10% off solid wood bedroom furniture and dining rooms. All mattresses in the Serta Perfect Sleeper collection, plus our Almost Heaven mattresses made right here in West Virginia. Come in and try them out, and you'll see why they're named Almost Heaven. Open 7 days a week. Pew Furniture Warehouse showrooms, 1320 Smith Street in Charleston's Furniture District. All prices met at pewfurniture.net.
Call us toll-free at 1-877-BUYPUGH.
If your business needs help in increasing sales or gaining exposure, then I can help you. Hi, this is Tony Caridi. Each day, our team at Pikewood Creative works with businesses and organizations to help them be heard, be seen, to tell their story. It all starts with a sit-down meeting, either in person or over the phone, over Skype, whatever, and at no cost or obligation, we'll listen to you and come up with a plan to help you be seen and heard. So let's get started. No cost, no obligation. Visit us at pikewoodcreative.com.
Every loan, everyone, every day. That's Express Mortgage. More than just a great rate, we treat you right. It's our service that keeps you satisfied. We're working for you. We're leading the way. Every loan, everyone, every day. Express Mortgage.
Equal housing lender, license 238174.
Summer will be here a lot earlier this year thanks to Spirit Airlines and Yeager Airport. Spirit is flying non-stop from Yeager to Myrtle Beach twice a week. The average Myrtle Beach temperature about 70 degrees, perfect for golf on over 120 courses. Also perfect for shopping, exciting shows, and the Carolinas' best dining. Go to Spirit.com to buy tickets and book your first flight of the summer now. Non-stop to Myrtle Beach from Yeager Airport, West Virginia's gateway.
Who'll go first, Gino or Tavon? Find out at the NFL Draft Party at the Charleston Civic Center Lounge on Thursday, April 25th. Catch the first round on TV and enjoy delicious tailgate food, including Black Bear Barbecue with smoked pulled pork and turkey, burgers, steak, chicken, and wings, plus a full bar featuring beer and other legal beverages. Free Mountaineer prizes from collectibles, etc. The NFL Draft Party, Thursday, April 25th at the Lounge in the Charleston Civic Center. Doors open at 6:30. Presented by the Charleston Civic Center and Distinctive Gourmet.
Good morning. Good Friday morning, I should say. I'm here with Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center, and certainly taking your calls, 304-345-5858, because it is the season. And what I mean by that is if all of you that suffer from this, I probably don't need much explanation. But the pollen is out there, and the allergens, and the mold, and all these wonderful things that certainly for the person with some issues in that area and any kind of sleep disorder, boy, it certainly gets enhanced during these times.
Yes, and what I wanted to talk about today just a little bit was sleep breathing disorders, because I'm always talking about apnea, but there's actually 3 disorders that are sleep breathing disorders, which are the snoring, upper airway resistance, and then the sleep apnea. And this time of year, the pollen causes inflammation in your sinus and the back of your throat, which contribute to the 3 disorders I'm talking about.
I just can imagine during this time, but I think you brought up something really good in the first segment, because you had actually suffered. My cousin, I seen him suffer. Get addicted for years on these nasal sprays that open up, open up your passageways instantly. But boy, just getting hooked on that. And as they say, there is a better way. And you were talking about these flushes that can certainly keep the pollen and different things out of there without creating that dependency or inflaming the tissue or even changing the tissue at all. And it's just kind of a sinus flush is what it's called?
Yes, it's a saline rinse. Saline being salt, but that way it doesn't burn when you use this. It's very comfortable. If you use just plain water, it is going to burn your sinuses when you flush them out.
And it's so strange that you're right. Just water out of the tap or even bottled water, there is kind of a burning. Yet a saline solution, what I think is kind of a salty water, doesn't. It doesn't seem to fit logic, but I know it works.
Yes, and it's more like the buffered pH that you're going to need with the saline. That's one reason it's not so uncomfortable, and it sort of mimics what's inside of your body.
What kind of symptoms? I know you talk a little difference about just breathing disorders versus an intense sleep apnea. What are some of those things that someone can kind of look to and say, "But I need to get in and see somebody about this"? What are some of those differences?
Well, of the 3 breathing disorders that I would like to talk about is snoring. That's number 1. There's a vibration of the soft palate, and it'll go 25 times a second. Oh. That almost reminds you of the punching bag. When you see a boxer, hitting the punching bag, that's going very, very fast. So the back of the palate goes 25 times per second. So that's one of the sleep breathing disorders. And the other one is upper airway resistance. And resistance is a decrease in the diameter of the back of the throat so that you actually don't breathe well. And one of the side effects of these disorders is daytime sleepiness that goes along with it. And then, of course, there's the sleep apnea where you actually stop breathing, cessation of breath for 10 seconds or longer.
And 10 seconds or longer, I know we've talked many times on this program, some of the people really stop for quite a bit more than that, really dangerous levels.
I've had some patients for a minute and a half or longer.
Oh, my goodness.
I went to visit one of my friends who just passed away recently, and he had, of course, when you have surgery, usually he broke his hip, or when these people have to lay on their back, then it makes you more prone to have an apnea event. So when I went down to see him, the nurse asked if you're family, and I said, no, I'm not family. And she said, well, you can't bother him. And I said, but don't bother him anyway, because he's having an apnea event, and I wanted to see how long, which was kind of cruel, but I wanted to see how long he would go.
Sure.
And it went for so long.
My.
I went, my goodness, do something. But, in some cases you can't take these surgery patients and roll them on their side, which is very beneficial. Back is death is what I tell my patients if they're very severe apnea. So you want to sleep on your side.
So sleeping on your back, although it's okay for most, but if you're suffering from any kind of sleep disorder, really not a good thing. And why is that? When you get on your side, what happens?
Well, you have to think of gravity. If you're on your back, it pulls your jaw backwards. Gravity's going to pull it backwards, and the tongue goes with it, which is going to decrease the diameter of your airway. So, in a CPR move, when someone's down, the second thing they tell you to do in a CPR move is to tilt the head back and pull the jaw forward. That's exactly what these patients need who have some kind of airway-resistant problem.
So it's really just a function of gravity. It's just, pushing back your tongue and jaw, all the things that you don't want to happen that actually hurts your ability to breathe.
Yes, and actually when we go to sleep, we have a muscle paralysis at times. When you go into like a REM sleep where you have the rapid eye movement, when you're in certain phases of sleep, and there's 4 phases of sleep, the body actually loses muscle tone. So when you lose that muscle tone, the tongue will collapse and fall backwards. So, and I'm sure there's some people out there that when you wake up, you think, well, I'll just jump up and then get ready, and all of a sudden you realize that your body's in a kind of a paralysis, and that's part of the sleep phase.
304-345-5858. 304-345-5858. Maybe you're trying to self-diagnose. Maybe you're saying, oh, look, everybody snores now and then, and this and that, but maybe it might be good to get a few questions answered today and maybe even set yourself up with at least an evaluation. I'm here with Dr. Jeannie K. Bailey and from the Sleep and TMJ Treatment Center. What's if you're suspecting a problem, who should you see? Which healthcare provider should you see first?
Well, your regular physician can direct you to the appropriate people. And the appropriate people would be a sleep lab, a board-certified sleep lab, which are independent or through our local hospitals. Then they would be able to meet with you, analyze your needs, and see if you need to have a formal sleep study by a board-certified physician.
So where it would start then, you would go to your regular physician, get in contact with one of these clinics, but they're not just going to put you in overnight. They're going to kind of give you some, ask a bunch of questions, do some evaluation, and then you might be asked to stay all night.
Yes, and which is what I do as well. I have many patients who come to me because they hear my radio show or they see my advertisement and they say, oh, my husband snores like a bear, or, I hear him stop breathing or her stop breathing, and then they come to me and I or any other dentist can refer them to the sleep lab so that they can have a formal consultation and then determine whether it is appropriate to have a formal polysomnography, a sleep test.
304-345-5858. I'm here with Dr. Jeannie K. Bailey, the Sleep and TMJ Treatment Center. And obviously, things that get a little intense for those people suffering with certain breathing and sleep disorders. It is allergy pollen season. It's pretty. We like the flowers coming out on the blooms on the trees and the bushes, but boy, it signals some rough sledding for you that suffer. What is when you talk about treatment, you say, what is treatment? Then what are some of the things that people are going to look for in their remedy and where you can advise them or even treat them?
Well, when you go and get your formal diagnosis, then it's a major medical issue. Now, I always talk about the comorbidity spin-offs that come from this. There's a lot of things that you have to be aware of that happen with this. But in the treatment, once you're formally diagnosed, the gold standard is a CPAP, which is a positive airway pressure. And actually how that was invented is the fellow worked on taking a vacuum cleaner and reversing the hose so that it would blow. And what that's doing is blowing the back of the throat open and blowing air in. Or you can have an oral appliance. An oral appliance actually does the CPR move where you move the jaw forward and therefore pull the tongue out of the back. And then we also do combination therapy. I have some patients that have to have an oral appliance and a CPAP together.
Well, you just wonder, after that, gee, what was happening before that? They must have been really suffering. But it's like many things. I guess we get used to the new normal as we kind of degenerate in this disease. You keep getting used to it until I guess it gets so acute it becomes, as you've pointed out to me many times, this is a life-threatening disease, and this is not just snoring. Sometimes it's not just a little bit of apnea. That's like being a little bit pregnant. It can actually be a life-threatening, and certainly it's doing damage along the way.
Yes, and this week, one of my friends who is a gynecologist, OBGYN, he invited me down to his office to speak to his staff because they have pregnant people. They have people who are surgical patients. So he said, can you talk to them so you could tell them the warning signs of when we need to recognize on our patients? Because, just so everybody out there knows, that last trimester of pregnancy, everything's growing and big, and about a third of those patients have obstructive sleep apnea from being pregnant. So, we talked about the surgical cases and we talked about the pregnancy cases and realize when it's time to get that sleep study. And usually in pregnancy, it's just temporary. After the baby's born and all the pressure's relieved, usually they go back to normal. But it's so nice if you could catch that early on in that pregnancy. The baby's actually healthier, and so is the mother.
What you just said was pretty shocking. Almost a third of women in their last trimester have some sleep disorder, some breathing disorders.
Yeah, and I don't think, many people, you blame everything on just being pregnant and getting big. You have the weight gain. Then you have the increase in your blood pressure. That is an indication of sleep apnea as well. And then restless leg, where these legs are moving all over the place. That's an indication. And the jaw actually moves. Those are movement disorders. People grind their teeth. So if you have a pregnant individual or someone of that category that has the grinding of the teeth, that's an indication. So there's a lot of spin-off factors that we just kind of blame on, the condition when it's actually a warning sign.
304-345-5858. If you'd like to talk to Dr. Jeannie K. Bailey today, Sleep and TMJ Treatment Center. Just to revisit some things. I know you've mentioned this before, but sometimes I think for me, the first time I heard this first show we did together, I was just stunned of how many people in America, what's the percent of people that are probably being affected by either a breathing or sleep disorder or full-blown apnea?
20% of all adults. 80 million Americans suffer from some kind of sleep-breathing disorder.
It's just, to me, incredible. So if we know that, if we know 20%, 80 million, and 20% of the people listening to this program and in this area, I would venture to say that percent would go significantly down about who's really getting treated.
It's amazing. But, then again, it's like what I said. You have to recognize the warning symptoms. So if you have loud snoring, that's not normal, particularly in children. I'm always saying catch it early. Find out early. And in the upper airway resistance in children, the first thing I do when I'm screening my children is I look at the size of the tonsils. And then if you do a tonsillectomy, the child has better ability to breathe because it doesn't have the golf balls back there to breathe around.
The golf balls. That's a pretty descriptive thing. Well, I remember when I got mine out. It was kind of a rite of passage in my age group. It was almost kind of automatic at a certain age. You were kind of headed for that. 304-345-5858 if you'd like to talk to Dr. Jeannie K. Bailey, Sleep and TMJ, sorry, I don't know where that one came in. It's a new disease. No, but let's go to our first caller. And Terry from Alum Creek. Good morning.
Good morning. How are you?
Good, Terry. What can Dr. Jeannie K. Bailey do for you?
Well, I have a question for my husband, actually. I mean, I'm in no way my doctor, but I know he probably has this sleep apnea. There's many, many, many nights that I have woken him up because he will just stop breathing. And, of course, he has no idea he's doing this. But my question is, and I can't get him to go to the doctor, so my question is, if this continues, what can happen?
Well, the comorbidities is a term I use, and all that is the disease that goes with it. He ends up with high blood pressure, heart disease, diabetes, there's a connection with arthritis, and stroke. Terry, no matter what it takes, sometimes you have to learn what language to use to wake people up. No pun intended on that, but, he needs to go have a formal sleep study if he wants to live.
Exactly, yeah. Mm-hmm. I've tried, and I don't think it's so much that he doesn't want to go. It's just finding, I guess, the time to go, and then when he does have the time, it's something else he'd rather do than go to a doctor. But yeah, there's been lots of nights where I've laid there and listened to him, and he'll just literally stop breathing, and I'll watch him for just a few seconds, and he'll just not breathe, and I'll reach over and shake him, and then he'll start moving and breathing again. So okay, well, I just wondered, I kind of caught the last bit of the show, but I just wanted to ask the question. I don't know if you'd already said this or not, but just thought I'd ask.
Well, please encourage him, Terry, to have a formal sleep study because it is life-threatening.
Okay, well, thank you so much. I appreciate it.
All right, Terry, thank you. Have a great weekend.
You do the same.
304-345-5858. Well, there you go. The very thing we were talking about the amount of people, 20 million or 80 million in America, 20% of everybody in this area having it. But again, resisting treatment or not thinking it's that bad or I'm okay, well, everybody snores or, all these little things we tell ourselves. But run through that list one more time, those comorbidities. In other words, what's happening to your body while you're suffering from this sleep apnea?
Well, think of it this way. When you stop breathing, you get no oxygen. So lots of bad things happen. Carbon dioxide builds up in your body, and you get a headache. And it causes memory loss. You have that unusual weight gain. And people who don't sleep well and have this, they have depression. So we're in a society now of Americans that are taking a lot of pills for depression when it needs to be looked at. Is it a sleep disorder? And the blood pressure and the heart attack and the stroke. Can I quickly share one little story with you? As a dentist, I screen every single patient on this, and I have one of my patients that I've treated for years, and he keeps coming in. I said, you really need a sleep study because I suspect, I can tell by looking in the mouth and the back of the throat if there's an issue, and I have a screening questionnaires. And I said, please go, and he says, no. Well, he had a severe stroke. And then he came back to me and he says, geez, Dr. Bailey, I wish I would have listened to you and maybe I could have prevented this.
And a stroke can be devastating. There's different types, different levels and degrees, but sometimes they change your life and your family's life forever. And this is one of the things you can do as a preventive. Go get a sleep study done. Go to your physician. And if you suspect that, and I hope Terry has success in convincing her husband that this is very, very important. And it is a life-threatening situation. This is Mike Agnello on WCHS with Dr. Jeannie K. Bailey, Sleep and TMG Treatment Center. The number to call here, 304-345-5858. This is WCHS, the voice of Charleston.
He's your authority on hunting and fishing. West Virginia Outdoors with Chris Lawrence, Saturday mornings from 7 to 8 on 58 WCHS.
Ever wonder if you're making a difference? As a fraternal financial organization, Modern Woodmen of America cares about the same things you do. We offer financial products and member benefits that can enrich people's lives. Isn't it time you belong to something that can make an impact?
Does your job have you in a slump? Enjoy a Hall of Fame career with Modern Woodmen of America. Go to MWAcareers.org to find out how.
Modern Woodmen, touching lives, securing futures.
Celebrating 50 years, the Creed family has been known as the lawn and garden family, selling and servicing only the best-known names, like Stihl, the #1 handheld power tool in the USA, BCS, #1 in the world in tillers and two-wheel tractors, Exmark, #1 in commercial mowers. Creed Tractor also has Snapper and Simplicity mowers. Come in for a free demonstration. Your quality lawn and garden shop is Creed Tractor in Big Chimney, 965-1666. Creed Tractor.
Come in, Star Command. Star Command, do you read me? It seems I've crash-landed in a big parking lot of some kind. I'm surrounded by brand new Chevrolets. There must be thousands of them. And there's a sign that says, every new Chevrolet, invoice and below. Only at Hurricane Chevrolet. I've always wanted a new Chevy truck. Star Command, over and out.
Space Ranger, where are you going?
To invoice and below.
I couldn't have said it better myself, so buzz on over to Hurricane Chevrolet. Every new Chevy on the lot, all priced at invoice and below, up to $15,000 off MSRP, plus $1 million in pre-owned vehicles, all with the triple check guarantee, covering price, quality, and car history.
To invoice and below.
$15,000 off MSRP. If you buy anywhere else, you'll pay too much. Big volume, big discounts, big old Hurricane Chevrolet. The fastest growing Chevy dealer in West Virginia, off I-64 at exit 34 in Hurricane. Call 1-800-NEW-CHEVY or HurricaneChevrolet.com. 2012 Silverado 3514. Rebates to dealer to qualified buyers.
One day, 120,000 liters. One mission. Infinite impact. Join 58 WCHS on May 10th for the 2013 Chick-fil-A LeaderCast broadcast. Live from Atlanta, Georgia to Charleston. You'll learn from the world's most influential leaders, including Jack Welch, Andy Stanley, Coach Mike Krzyzewski, John Maxwell, Henry Cloud, Rourke Denver, Sonia Richards-Ross, David Allen, and an exclusive video interview with Condoleezza Rice. Plan now to take part in this unique leadership experience, one that unites over 100,000 leaders from around the world. Join WCHS at the University of Charleston for the May 10th, 2013 Chick-fil-A LeaderCast. Visit 58WCHS.com and click on the Chick-fil-A LeaderCast link to purchase tickets. Group discounts are available. The 2013 LeaderCast, presented by Chick-fil-A, the University of Charleston, and 58 WCHS.
This is Mike Agnello on Ask the Expert, and that expert is Dr. Jeannie K. Bailey, Sleep and TMD Treatment Center, 304-345-5858. You know, Doctor, you wanted to, if Terry's still listening, who called in, you wanted to add something that she might try.
Yes, Terry, what you may want to do is you may want to take your phone, where it will record, or you can actually make a movie. Make a movie and let him hear himself. Make a recording audio-wise. Let him hear himself, because that kind of makes things more real. There's actually a free app that you can get on snoring, like on your little iPhone there, and you can download a free app, and it'll record your snoring all night long. So do that for him, Terry, and see if that makes it a little bit more real.
I think that's really a great idea because, we all... Let's be honest, especially, I think men may be the worst offenders at this. We are evaders of medical attention. We don't want to go to the doctor until we, kind of have to. We avoid things. We mitigate it. We minimize it. Everybody snores. But I think to hear it and see it, and especially if he has a long interval between his breathing cycle, it would really... It's kind of a, what they call a little come to Jesus moment, like, hey, this is what's happening. And as a wife or as a husband, here's what I'm seeing. And you don't see it because you're asleep. You don't know this is going on. I think it's an excellent idea. Now, this phone app, how does that work? You just, you kind of engage it and you just set it next to your bed all night?
Yes, and it will record your breathing pattern and your snore noise all night long. So it is a downloadable free app. Now, one of my patients, his wife brought him in, and she come in carrying her little iPad, and she says, I want you to watch this. He doesn't think it's serious, but I want you to look. And she had filmed him sleeping and says, what do you think? I went, red alert, Captain, we have a problem. He didn't think there was a problem, but, the video made it more real for him how serious it is.
Well, that's our advice, Terry, and hope you're still listening. 304-345-5858, 304-345-5858. I love that idea about the downloading this free app. And maybe, like me, you live alone, so there's no one to do the filming, but just to see. I mean, I don't know, but, I don't sleep as well as I used to. I work a ton of hours, so, I'm Dr. Einley. I'm going to do that. I'm going to download that app and for a couple of nights and just monitor, just see what comes up out of there. I hope I don't say anything embarrassing, but have a nightmare or something. But I hope that's true. 304-345-5858.
Now,
let's go. We just got a couple phone calls coming in.
Okay.
We want to get to them. And Scott from good old Sod, West Virginia. Hey, Scott.
How you guys doing today?
What's going on, brother?
Just living the dream. Well, I have a comment and a question. Actually, the question's for you, Mike. Do you have some sort of sleep apnea? Because, all the hours you work at this station?
Well, that's a good question. And sleep has become a little bit of an issue. And, in fact, I was telling the doctor, and I mean it, I am going to use that app and, monitor myself a couple nights because of the different hours. And sometimes if I have I'm on 7 to 10 at night and I've been here early, you're all hyped up. So when you get home, to be quite honest, you don't it'd be like asking somebody that got off work at 6 o'clock to go home and go to bed by 8 o'clock at night. Well, that's not going to happen. Well, the same for me. I have to kind of wind down. So, but really, I'm going to take Dr. Jeannie K. Bailey's advice and download that app and just monitor a couple of nights and see what comes up.
Well, my comment is this. I've listened to the show a few times, and I don't know if you all know this or what, but the football player Reggie White of the Green Bay Packers, he died from sleep apnea.
Yes, he did. I always use him when I lecture all around the country. I use Reggie's name quite a bit.
Well, Scott, I did not know that. So how old was he? Do you remember?
No, I don't. I even just double-checked my sources before I called to say this to you all.
And, when they interviewed and checked the background of Reggie, he had it as a child. And he snored as a child very loud. So that is one of the things, that's why I always say children should not snore.
Well, does snoring really play into it? Because I was always told, even as a teenager, I didn't just snore loud. I was like a chainsaw going up and down.
Snoring is a number one indicator of obstructive sleep apnea. It doesn't mean that you have it. But, when I teach, I always have everybody, all these doctors in the room and the people in the room, put their hands on the side of their neck and make a loud snore noise. And it vibrates the carotid artery. And they think that not only the inflammation in the back of your throat occurs, but you have clogging of the artery, atherosclerosis from that.
Well, that's all I needed to say and ask, and you all have a nice weekend.
Well, thanks a bunch, Scott.
Okay, thank you, sir. 345-5858, 345-5858. Well, there you go. Someone that also, another Scott, and I know Scott, he's called the show many times. He's also called my evening show, but someone that snores but kind of an old wives' tale, it doesn't have much to do with it. But to be quite frank, the very opposite is true.
Absolutely. And we also run home sleep tests for people who are afraid to go to the sleep lab. We do that, and that way you can monitor the person. And you were talking about the snore noise. Well, when I started doing home sleep testing, which has been many, many years ago, I was always amazed. I can listen to what people do all night, and when I go to the sleep labs and watch patients, they talk in their sleep. And that was the part that really shocked me, too, because people will just have full-blown conversations. And I wasn't prepared for that. I was listening more for the snore instead of the talk.
Well, that's what I'm saying. Before I let you hear it or anybody else, I'm going to have to kind of go through it and make sure I'm not saying anything embarrassing because I thought, dreaming kind of stopped for me for a while, but it's kind of kicked up a little bit again. So I don't know what that means exactly, but I'm sure if I'm dreaming, I might be doing some uttering. 345-5858. I'm here with Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center. And let me give out her number. Maybe you're kind of going through that thought process right now and, could I have an issue? And when you hear about all the symptomatic things that may be happening and then all the dire things that may be happening to your body too, you'd like to call her office and at least get an evaluation or at least a consultation on what your next step might be. 757-7428. That's 757-7428.
And I always, Mike, point out on every single show, I'm a general dentist. I just have special interest in TMJ dysfunction, people who have the chronic headache and the pops and the clicks and the pain, and I have special interest in sleep. I can't say like I'm the expert in this area, even though that's the name of the show. I'm just a general dentist with special interest in these areas.
And someone, again, you just simply followed your passion, educated yourself, went to some other things just to try to, obviously, these things overlap. Where your practice as a DDS, certainly these things overlap. And you were talking before, too, about actually, because when someone comes in your office, they're opening their mouth. You're looking at tissue. You're looking at teeth. You're looking at gums. I mean, it's kind of a natural progression, I think, especially when you have interest in this area, that when you see things that are a little troubling, well, that's when at least you can advise to them to go and get other treatment in other places.
And sleep recognition is becoming huge. In the last 20 years, sleep has blossomed. We're seeing the warning signs. And, I lecture all over the place, and I really point out to many dentists, here's what you look for that should be a red flag, especially when people grind their teeth. That's a warning sign. They're trying to open the airway up in some cases when they have the breathing disorders.
Well, I think the thing you said earlier, I think is, to me, a red flag. It's like a cannon, and that is the explosion. Well, maybe not explosion. Maybe that's too harsh of a word, but the amount of people being treated for depression, the amount of antidepressants being handed out by the bottleful. And it could be so much linked to their inability to get a good night's sleep and have their body do all the restoration and recovery things that should be going on. I think, to me, that's a huge red flag.
It is, and, when you were saying you had dreams are wonderful. We should be dreaming. The brain is like a computer. When you have your little scan on the computer and you defrag, that's what everybody is doing when they're asleep. And we're asleep a third of our life. So that's a time for the brain to reorganize and help solve problems. And you really need a quality, because if you don't get the quality sleep, then you lead to things like depression.
Well, again, one of the major things we hear about, especially in West Virginia, prescription drug issues, not that sleep apnea causes drug use, but I just think the dependency on drugs is, I don't know, maybe it's come to a place I think we should all look at it again, the medical profession, the mental health profession, just kind of re-looking at things and what are the causations rather than just the treatments. And I think for me, it's just, and I hear so many young people, elementary school, even on just being handed so much medication, not to say that some of it shouldn't be, or it's, I'm certainly not trying to go against the medical or mental health facility profession, but boy, just getting a good night's sleep really makes a heck of a difference in someone's life.
Yes, and it's important that the physicians, when they're doing this, it's a very complicated thing because some of the medications cause the muscles to relax in the back of the throat. So even though the person is actually sleeping, they're not getting that good quality restorative, where the brain is actually defragging and learning how to handle things. They do not get the good quality sleep because the back of the throat's relaxing and they're getting the apnea. So some medications backfire on you.
I'm here with Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center, 304-345-5858. Take our final break. We'll be back. Mike Agnello on WCHS, the voice of Charleston.
The voice of Charleston is in the palm of your hand with the 58 WCHS app. Download it now for free at 58WCHS.com.
Fed up with the cable company's contracts and constant rate hikes? Make a simple choice. Frontier High-Speed Internet. It's just $19.99 a month with qualifying phone service. Call 1-888-FRONTIER today to make the switch. Unlike cable, our price is guaranteed for 3 years with no contracts. Plus, you get gamer-certified speeds and a wireless router is included, which makes it easy to stream movies or surf the web from anywhere in your entire home. Get it all for just $19.99 a month. And that price is guaranteed for 3 years. So call 1-888-FRONTIER to start enjoying high-speed internet from Frontier. We've got simple pricing, flexible plans, and best of all, it's easy to switch. But hurry, offers this good and simple don't last long. Get the high-speed internet you deserve without the contracts or complications. Call 1-888-FRONTIER now. Limited time offer with qualifying new services. All rights reserved.
Welcome back. Mike Agnello and Ask the Expert. Final few minutes with Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center. Let me give out her number again, too, if you'd like to call and at least get a consultation. Some good advice. 757-7428, 757-7428. Maybe in closing, I don't know where you want to go, but we talked about, 20% of people suffer from some kind of sleep disorder. You've got, it's 80 million people in America. But what about age and weight? Are those complications, or can it happen to anybody?
Well, age, how many overweight children are we seeing now? Well, did they get heavy because of sleep apnea as a spinoff, or did they get heavy because of the unhealthy diet? So it's really important to look early on this. And on age, it starts early, and it gets, as we get older, we have a tendency to get loose, flappy tissue. Unfortunately, we don't have the muscle tone that we had when we were young.
Sure.
So it does become worse as we get older.
Well, you brought up that perfect example when Scott called in about Reggie White literally dying from his sleep apnea. And looking back, I guess, when they were doing whatever questions I asked the parents or whatever, but here he was a snorer, a big snorer when he was a young boy even.
Yes, and that's so important. And I try and drive it home to my audience. If your children snore, you should seek your pediatrician, your ear, nose, and throat specialist. Ask your dentist about it, because the dentist, every exam, looks in the back of the throat. So now we see those enlarged tonsils and adenoids. They need to be treated.
And what about tonsils and adenoids? Again, in my generation, it was kind of automatic. At a certain age, you're getting them out. Or if they got inflamed, you're having some issues. Have they pulled back from that just a bit?
They pulled back, but now they're going back. They see the importance when it's so large and the child is snoring and can't get good quality sleep. Now there's easy, simple solutions. It's not as big a surgery as it used to be.
Right. Well, I can remember, and it happened when I was really young, but I still remember waking up in that hospital, and oh my gosh, that throat was just terrible. You just couldn't hardly talk. And when you're little, you don't handle pain quite as well. But I do remember the sherbets. I do remember that was the first thing they let me have, was that nice, cool sherbet. Hard to swallow, but boy, it felt good back there.
Oh, definitely. And, do parents, if your child snores, think this is not normal. If it's prolonged, you need to seek some kind of medical health care advice.
And we'll remind you, if you just joined, there's a free app. That's right on your smartphone, and you can monitor yourself. I'm going to do it. I live alone, but I'm going to try that, Dr. D.K. Bailey, and provided I don't say anything embarrassing, I'll let you hear it.
And back to the weight thing, a lot of my patients are skinny who have these disorders. So you don't have to be overweight to be thinking, oh, it's an overweight problem, because I have a lot of skinny people who have breathing disorders.
Again, we're here with Dr. Jeannie K. Bailey, Sleep and TMJ Treatment Center. Let me give out her number one more time. We're getting close on our time here together. 757-7428, 757-7428. Well, Dr. Jeannie K. Bailey, as always, a good education for me today, and I'm going to download my app, and I'll let you listen to it after I edit it. Thank you, Dr. Bailey.
Thank you so much. I had a wonderful time.
Me too. All right, you know what's coming up. Hoppy Kercheval Talk Line. You know what he's going to hand, and then Rush Limbaugh, of course, and Hotline, and then some baseball. Keep here all day. We'll be keeping you abreast. National news coming up, too, ABC, about this breaking story in the Boston area. One dead, one on the run, the Marathon Bombers, as the story evolves. We'll keep you informed. Stick with us all day, and we'll keep you informed. This is Mike Agnello on WCHS, the voice of Charleston.